I want you to stop whatever you're doing right now and listen to me very carefully, because in the next few minutes, I'm going to share something that took me 35 years of treating elderly patients, thousands of them, to fully understand. And I can tell you with complete confidence, most of what you've been told about lowering blood sugar is either incomplete, overcomplicated, or flat out wrong. I'm Dr. Leonard Brooks. I've been a geriatric physician for 35 years. I've sat across from patients in their 60s, 70s, and 80s who were scared, frustrated, and exhausted, not just from their diagnosis, but from trying everything their previous doctors told them and still watching their blood sugar creep higher, higher A1C, higher fasting glucose, higher frustration. And here's what I learned after seeing this pattern repeat itself thousands of times. The problem isn't that my patients weren't trying hard enough. The problem is that nobody gave them the right tools. So today, that changes. Today, I'm going to give you 7 science-backed strategies that I personally recommend to my senior patients. These are not extreme diets. They are not dangerous fads. They are not things that require a gym membership, a nutritionist, or a pharmaceutical budget. These are real, accessible, research-validated interventions that improve insulin sensitivity, lower A1C, and help you take back control of your blood sugar. And some of them work faster than you'd ever expect. If your blood sugar is spiking after every meal, if your A1C is climbing at every checkup, if you feel tired, foggy, and stuck, this is the most important video you'll watch this year. Let's begin. Number 1. High-intensity interval training, the fastest blood sugar drop available to you. Now, I know what some of you are thinking. Dr. Brooks, I'm not 25 years old. I can't do intense exercise. And I hear you, but I want to redefine what intense means, because this first strategy does not require you to be an athlete. It requires less than 10 minutes of effort. That's it. We've known for years that cardiovascular training and resistance training are powerful tools for blood sugar management, and I absolutely encourage both. But when it comes to dropping blood sugar quickly, I mean rapidly, within hours, nothing I have seen in the research or in my clinical practice compares to high-intensity interval training. What is HIIT, and why does it work so fast? HIIT involves short bursts of intense movement. We're talking 30 seconds. Followed by a rest period. That's it. 30 seconds of effort. Rest. Repeat. The movements themselves can be as simple as marching in place vigorously, doing seated leg lifts rapidly, standing up and sitting down quickly from a chair, whatever your body allows. What makes HIIT so powerful for blood sugar is the mechanism underneath it. When your muscles contract intensely, they consume stored glucose at a dramatic rate. And once those stores are depleted, your muscles become what I call glucose-hungry vacuums. They start pulling circulating sugar directly out of your bloodstream, and they do this completely independent of insulin. That's the key. No insulin required. The muscles handle it themselves. A 2024 meta-analysis reviewing 22 randomized controlled trials found that HIIT reduced A1C levels, lowered fasting blood sugar, improved triglycerides and LDL cholesterol, and boosted HDL, the good cholesterol, with particularly strong outcomes in patients under 60 and in those within the first 5 years of their diagnosis. The researchers concluded that these patients still have responsive insulin systems, less cumulative vascular damage, and a greater capacity to reverse metabolic dysfunction with the right intervention. How to apply this in real life? For my senior patients, I recommend 3 to 4 HIIT sessions per week. Each session is only 20 to 30 minutes total, but the actual intense effort within that session is less than 10 minutes. Here's a simple structure: 30 seconds of vigorous effort. This could be fast walking in place, step-ups on a low step, jumping jacks if tolerated, cycling on a stationary bike, or even rapid arm circles. Then rest for 60 to 90 seconds. Repeat 5 to 7 rounds. The physiological benefit lasts 24 to 48 hours. That means one brief session builds momentum that carries you through the next day and a half. This is precisely why it works fast and compounds over time. Start slow, listen to your body, but start. Number 2. Apple cider vinegar. Before meals, simple, powerful, but use with caution. This one surprises many of my patients when I mention it. It's inexpensive, it's available at any grocery store, and the research behind it is genuinely impressive. Taking just 1 tablespoon of apple cider vinegar, diluted in 8 ounces of water, before a meal has been shown in multiple studies to reduce post-meal blood sugar spikes by 20 to 34%. For someone managing type 2 diabetes or prediabetes, that is a clinically meaningful reduction. Why does it work? The active component is acetic acid. It works through 2 pathways. First, it slows gastric emptying, meaning food moves from your stomach into your small intestine more gradually, which smooths out the glucose release into your bloodstream. Second, it enhances your muscles' ability to absorb and utilize glucose. The result is a blunted, slower blood sugar rise after eating. However, I have to be honest with you as your physician, because that's my job. Apple cider vinegar is effective in the short term, but long-term daily use carries real risks. The acidity can erode tooth enamel progressively. It can also irritate and inflame the esophageal lining. I've had patients experience persistent burning sensations after a single use. Some tolerate it well, others do not. My clinical recommendation: use ACV as an occasional tool, not a daily ritual. If you find it bothers your throat or teeth, discontinue it and move to the next strategy, which in my opinion is a safer and more sustainable option. Number 3. Berberine and magnesium glycinate, the supplement combination I recommend most. Over the past decade, one supplement has risen above all others in the peer-reviewed literature for blood sugar management, and I was skeptical at first, as any physician should be, but after reviewing more than 50 randomized controlled trials, I am no longer skeptical. That supplement is berberine. What berberine does: berberine is a plant-derived compound that has been shown repeatedly and consistently to lower A1C, reduce fasting blood glucose, improve insulin resistance, and support better lipid profiles. It is frequently compared to metformin, one of the most prescribed diabetes medications in the world, in terms of efficacy for blood sugar reduction. This is why some researchers and clinicians refer to it informally as nature's metformin. The mechanism is complex, but the core of it is this: berberine activates AMPK, a cellular enzyme that acts as your body's internal energy regulator. When AMPK is activated, your cells become significantly more efficient at taking up and burning glucose. Fat metabolism improves. Glucose uptake improves. Insulin resistance begins to reverse. For my patients, I recommend a minimum of 1,000 milligrams per day. Based on the pharmacokinetics, how the body absorbs and processes it, I find that splitting the dose works best. 600 milligrams in the morning with food and 600 milligrams in the evening with food. This provides consistent around-the-clock coverage rather than one large peak and a long valley. Why magnesium glycinate must come with it? Here is something that does not get enough attention in conventional diabetes care, and it frustrates me deeply. Magnesium deficiency is alarmingly common in people with high blood sugar. Studies estimate that between 14 and 48% of individuals with type 2 diabetes are magnesium deficient. I know that's a wide range, and that's because the studies use different measurement methods. But what matters for you, sitting here watching this, is the clinical reality. Low magnesium impairs insulin signaling at the cellular level. It contributes to poor glucose regulation, it disrupts sleep architecture, and it worsens insulin resistance, creating a vicious cycle. Magnesium glycinate, specifically this form, not magnesium oxide, is highly bioavailable and gentle on the digestive system. I recommend 275 milligrams taken before bed. It supports deeper sleep, reduces nighttime cortisol fluctuations, relaxes muscle tension, and lays the foundation for better metabolic function the following day. Berberine during the day, magnesium glycinate at night. Together, they are the most consistently impactful supplement protocol I have recommended in my clinical career. Number 4. The post-meal walk, 15 minutes, that change everything. This is the strategy I am most passionate about sharing with my senior patients because it is free, it requires no equipment, it has no side effects, and the evidence for it is remarkable. The moment you finish a meal, and I mean within 5 to 10 minutes of setting down your fork, I want you to go for a walk, not a power walk, not a hike, a gentle, comfortable 15 to 20 minute stroll, the science behind it. During movement, your muscles can absorb glucose from the bloodstream through a mechanism called contraction-mediated glucose uptake. This is completely separate from insulin-dependent uptake. The muscle contractions themselves, even gentle ones, activate glucose transporters on muscle cell surfaces. Those transporters pull sugar directly out of your blood. A well-designed 2017 randomized crossover study made a finding that I have referenced in patient consultations many times since. Walking for 15 minutes after meals was significantly more effective at reducing post-meal blood sugar than a single 45-minute walk done at a different time of day. The timing matters. Walking when glucose is actively entering your bloodstream from digestion is the key. You are intercepting the spike before it forms. For my patients with mobility limitations, even gentle movement in a chair, leg extensions, foot circles, seated marching, can provide a meaningful benefit. The principle is the same. Muscle contractions activate glucose uptake, the compounding effect. Do this after lunch and after dinner every day, not occasionally, habitually. What I've seen in my patients over months is that this single habit, done consistently, produces a compounding effect on fasting glucose and A1C that rivals many pharmaceutical interventions. The body learns. Insulin sensitivity builds. The post-meal spikes shrink. It sounds too simple. I understand the skepticism, but sometimes the most powerful interventions are the ones that don't require a prescription. Number 5. Fasting and fasting. Mimicking diets. Giving your body permission to reset. I want to address something important before we talk about fasting, because I hear the concern in many of my patients' voices. Dr. Brooks, I can't starve myself. And my answer is always the same. I'm not asking you to. There is a significant difference between starvation and strategic fasting. What I'm describing here is a deliberate, structured approach to giving your digestive system and your insulin system regular periods of rest. Time-restricted eating. The 16-8 approach. The simplest form is time-restricted eating, specifically the 16-8 protocol. You confine your eating to an 8-hour window and fast, water only, for the remaining 16 hours of the day. A practical example: stop eating at 7 in the evening and don't eat again until 11 the following morning. That's it. Most of those fasting hours are spent sleeping. During the fasting period, your insulin levels drop significantly. When insulin is low, your body shifts from storing glucose to mobilizing and burning it. Fat cells release stored energy. Cellular cleanup processes activate. Insulin sensitivity begins to reset. Fasting-mimicking diets. A more advanced tool. For patients who want to go deeper, I have been deeply impressed by the research surrounding fasting-mimicking diets, or FMDs. I first encountered this work through Dr. Valter Longo's book, The Longevity Diet, and spent considerable time reviewing his clinical research. An FMD involves 5 specific days per month in which you consume a precisely formulated, very low-calorie, low-protein, high healthy fat diet that fools your body into activating fasting pathways while still providing nutrition. You are not starving, but metabolically your body behaves as though it is fasting. The documented benefits for metabolic health are significant: improved insulin sensitivity, reduced fasting glucose, decreased visceral belly fat, and measurable A1C reductions, often within weeks of the first cycle. I followed this protocol myself and experienced firsthand the clarity, the metabolic shift, and the sustained improvement in my own insulin markers. I recommend it with appropriate medical supervision, particularly for patients on medication that may need dose adjustment during fasting periods. Number 6. Resistance training. Building the infrastructure for lifelong blood sugar control. I want you to think of your muscle tissue as a storage tank for glucose. The larger and healthier that tank, the more sugar your body can pull out of circulation and store safely. Conversely, the smaller and weaker that tank, which happens with age-related muscle loss, called sarcopenia, the less capacity your body has to clear glucose from the blood, and the harder it is to maintain healthy levels. This is why resistance training is not optional for my patients managing blood sugar. It is essential infrastructure. How muscle mass changes your metabolic baseline. Walking activates your glucose vacuum. HIIT cranks it to maximum speed. But resistance training physically enlarges the vacuum, building more muscle tissue, more storage capacity, more insulin receptor density. Every pound of lean muscle you build or preserve is metabolically active, quietly absorbing glucose around the clock, even when you are sitting still. The relationship between muscle mass and insulin sensitivity is one of the most well-established findings in metabolic medicine. In older adults, preserving muscle mass is not just about physical strength. It is about survival, metabolic function, and quality of life. A practical starting point. For my senior patients, I recommend 3 to 4 sessions per week of 30 to 40 minutes. The movements should be compound, meaning they engage multiple muscle groups simultaneously. Squats, chair squats, rows with resistance bands, lunges with support, wall push-ups, seated leg presses. You do not need a gym. You do not need expensive equipment. A set of resistance bands and a sturdy chair can get you started immediately. The goal is progressive overload, gradually challenging your muscles a little more each week so they continue adapting, growing, and improving their glucose handling capacity. Every session you complete deposits into a metabolic account that pays dividends 24 hours a day, 7 days a week. Number 7, sleep and stress, the hidden drivers sabotaging everything else. I saved this for last because I believe it is the most underestimated factor in blood sugar management, and the one most consistently overlooked in standard medical practice. You can follow every other strategy on this list with perfect discipline. You can exercise, take your supplements, walk after meals, and fast correctly. And if you are sleeping poorly and living under chronic stress, your blood sugar will still resist coming down. I have seen this pattern more times than I can count. The sleep-blood sugar connection. The data here is unambiguous. One poor night of sleep, defined in key studies as 4 to 5 hours rather than 7 to 8, reduces insulin sensitivity by up to 25% the following day. 25%. That is a clinically significant impairment from a single night. Sleep is when your body repairs its insulin receptors, processes cortisol, consolidates metabolic function, and prepares the hormonal environment for a healthy next day. Deprive the body of this, and you are fighting an uphill battle against your own physiology, regardless of what you eat or how much you exercise. Cortisol, the stress hormone that dumps glucose into your blood. Stress triggers the release of cortisol, a hormone with a very specific and ancient function. It signals the liver to release stored glucose into the bloodstream to prepare the body for a threat. This is evolutionarily brilliant. In the context of modern chronic stress, it is metabolically catastrophic. If you are under sustained psychological stress, financial pressure, caregiving burden, health anxiety, relationship conflict, your cortisol is likely chronically elevated. And elevated cortisol means your liver is continuously releasing glucose into a bloodstream that your body's insulin cannot adequately process. Your blood sugar will not come down under these conditions, no matter what else you do. What I recommend to my patients. 3 specific interventions have made the most consistent difference for my patients and in my own life. First, magnesium glycinate, 275 milligrams, 1 hour before bed. This is the same supplement I recommended in tip 3. It relaxes muscles, quiets the nervous system, and significantly improves sleep depth and continuity, which we now know is directly tied to next-day insulin sensitivity. Second, ashwagandha for cortisol regulation. This adaptogenic herb has robust clinical evidence for reducing cortisol levels, improving stress resilience, and enhancing sleep quality. I recommend 655 milligrams taken with a small amount of black pepper which contains piperine and enhances absorption significantly. Third, breathwork before sleep. I know this sounds too simple. I thought the same thing when I first encountered the research. But 5 minutes of slow, deep diaphragmatic breathing before sleep has been shown to activate the parasympathetic nervous system, your rest and digest system, drop heart rate, lower cortisol, and prepare the body for restorative sleep. No app required, no specific technique, just slow, intentional, deep breaths for 5 minutes while lying in bed. I wear a continuous health monitor, and the difference in my overnight heart rate variability, a proxy for nervous system recovery, between nights when I do this and nights when I don't is measurable and consistent. The data supports the practice. Let me leave you with this. In 35 years of medicine, I have watched countless patients feel helpless in the face of a diagnosis that they were told was simply managed with medication. And while medication has its place, I prescribe it when appropriate. I have also watched patients make targeted, strategic changes to their daily habits and transform their metabolic health in ways that surprised even them. The 7 strategies I have shared with you today are not miracle cures. They are evidence-based tools that work with your body's own physiology to restore the sensitivity and efficiency your metabolism was designed to have. Here is the complete list. 1. High-intensity interval training. 3 to 4 times per week, less than 10 minutes of intense effort per session. 2. Apple cider vinegar before meals. 1 tablespoon in water, used occasionally with awareness of its limitations. 3. Berberine-plus-Magnesium glycinate. Berberine in split doses during the day, magnesium at night. 4. Post-meal walking. 15 to 20 minutes immediately after eating, every single meal. 5. Fasting mimicking diets. Time-restricted eating daily, FMD monthly for deeper metabolic reset. 6. Resistance training. 3 to 4 sessions per week to build and preserve metabolic muscle. 7. Sleep and stress management. Protect your sleep, regulate your cortisol, and treat your nervous system as the metabolic organ it is. You do not need to implement all 7 at once. Pick 2 or 3 that feel accessible to you this week. Build momentum. Add more. Your body is more capable of healing than you have been led to believe. I've linked resources, supplement recommendations, and a beginner movement guide in the description below. If this helped you, please share it with someone you care about, because this information should not be hard to find. I'm Dr. Leonard Brooks. After 35 years of practice, I still believe that the best medicine begins with knowledge. Now you have it. Take care of yourself. I'll see you in the next one.